Millions of unpaid carers will be able to book care and prescriptions on the NHS app. I'm going to read into this exclusive from the iPaper, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from the iPaper with a headline that millions of unpaid carers will be able to book care and prescriptions on the NHS app. A new function on the NHS app will be rolled out nationally from next March to help 5 million people manage a loved one's care. Guys, while you're here, make sure you hit the like button, share it across social media so others are notified of this video. This is overdue. This is long overdue. I'm totally in favour of this. I think anything that helps reduce bureaucracy, I think as time passes on and pretty much everyone is accumulated, pretty much the older generation, obviously, our older generation are not really getting on with the apps, but as time continues to pass, more and more people become used to using mobile phones, using apps, and etc. And pretty much the majority of the population is doing it. But obviously, the older seniors are still not quite gripping it when it comes compared to the young whippersnappers or normal adults of this day and age. But the NHS app is supposed to be, and I'm glad that they're moving more on this when it comes to the National Healthcare Service and an app for it, because this will make things a lot easier. You know, calling up can be a real pain in the ass when it comes to booking appointments. Having apps that can do these things for you without actually the need for manpower to actually manage things like this can save so much time and money for the National Healthcare Service. Now, obviously, I really want this to succeed, and I really do mean this when I say, if this means better care for people, if this means that people are able to book prescriptions a lot easier, I'm all for this. But obviously, like everything, there's going to be questions that need to be asked about it. But they've already done successful trials on this, which is why they're going to be rolling it out. So let's read a bit more into this, you guys. So millions of people who have cared for loved ones unpaid will be offered digital help to make handling hospital appointments, prescriptions, and care plans easier and stop them being passed from pillar to post, the iPaper can reveal. So a new function on the NHS app called My Carer will be rolled out nationally from next March after trials showed it successfully cut back on bureaucracy for unpaid carers. The details are part of the NHS's 10-year plan launched by Keir Starmer and the Health Secretary Wes Streeting last Thursday. The Care Minister Stephen Kinnock, in an interview with the iPaper, said that My Carer will make a difference to more than 5 million people in the UK who currently look after a relative, friend or neighbour without receiving money. And after a difficult week for Labour, Kinnock also warned the government had to get reform on the NHS right, or risk the rise of snake oil salesmen of parties like Reform UK, who said they want to privatise the health service. From March 2026, users of the NHS app will be able to add the My Carer function to manage appointments, prescriptions, medical history, and care plans for the person they look after, all in one place, simplifying it. The platform will be accessed securely and would need permission from the individual being cared for, while also be used by carers as proof of identity when interacting with GPs, hospitals, and pharmacies. The government said it will end frustrating repeated conversations, missing appointments and timings, and help carers better coordinate and plan the care for their loved one or friend. Yep, I agree. If it does this, I'm all for it. Kinnock said that My Carer, along with other measures on the social care in the 10-year plan, will be introduced in tandem with the ongoing cross-party Casey Commission into social care, which is not due to publish its first report until 2026. Government has spent £711 million last year and this year on improving conditions for unpaid carers and the individual that they look after, including this year an uplift on £172 million on the disabled facilities grants, which could fund around 15,600 homes adaptations, helping people live independently in their homes. Kinnock said the NHS app would be right at the heart of the 10-year plan across the entire waterfront of health and social care, and that My Carer would be a real step forward for unpaid carers. He told the iPaper, why is it that people are doing so much of their banking online, booking travel in online? Why shouldn't our interaction with public service, and particularly with our health and social care, be done in the same way? Exactly. Unpaid carers are the cornerstone of our care system, but fundamentally the system isn't set up to facilitate unpaid caring, to support unpaid caring and make their lives as easy as possible, and they'll often find themselves being passed from pillar to post. Often a person who draws on care is interacting with a number of different clinicians, might be a GP, might be somebody in a secondary care setting, might be somebody in community care. Kinnock said that unpaid carers often face a nightmare in trying to book appointments and managing test results. Improvements to the NHS App, part of a greater digitalisation of the health service, forms a key part of the 10-year plan. A plan to introduce a single patient record where people can store and view their complete medical history, expected to be rolled out nationally from 2028. Patients will also be able to seek AI-assisted medical advice based on their medical records, and this will make self-referral for services such as mental health treatment. I have reservations about artificial intelligence being used in this part, but I also understand why they want to push this as now. Ministers want NHS App, which was first launched in 2019, to be improved to create a full digital front door to the health service, which would be a massive boon for productivity across the board. Kinnock added hundreds of millions of pounds are lost in terms of the cost just sending out all these letters. For example, that we'll be able to cut back on that. And he said that My Carer function would be founded on GDPR principles and legal provisions to prevent abuse of the system. The minister added that patients and carers will be able to see a quantitative difference before the next election. Kinnock said publications of the 10-year plan was a huge moment for the country. And he added, we talk a lot about the NHS almost as if it's a thing in its own silo. It really isn't. It's the foundation of our economy. You cannot have a successful and productive and prosperous economy without a strong NHS and care service at its foundation. We talk about wanting to have a really strong and cohesive society and culture in our country. You can't have that without a strong and effective health and care system. Yeah, we agree. I think the difference now is the sense that if we don't get it right this time, we really could end up in a situation where we have some of the snake oil salesmen in other parts of political life who we know want to privatise the NHS. You do not want to be paying for your cancer treatment, people. That's what Reform want you to do. Who want to turn it into a private insurance-based system that is not free at the point of use and is based on your ability to pay rather than your clinical need. And this Labour government will never allow that to happen, but this is a moment of truth, and that's why I think it is just a really, really big moment for this country. I can't stress enough how important it is to protect our national healthcare service. And trust me when I say that having NHS free at the point of use, for us to be able to go to it, not worry about the cost for it, for ourselves, having that taken away from us would be devastating. We only need to see just what's happening in America when it comes to people's lives over there, when it comes to their healthcare. We don't want that here. We don't want it. We don't need it here. I cannot stress this enough. And I really am very optimistic about this. I'm feeling quite positive about this NHS app and the functions and improvements that they're looking to make to it. And my hope is that over the next few years, we will see our NHS in a much better position with much more advanced technology in doing so. Do I agree with the use of private companies and functions in our NHS? No, I don't agree with it. However, if this helps save lives, if it makes things easier, if it makes better care for others, I'm all for making people's lives better, regardless of my political affiliations. So I want to know what you guys honestly think about the NHS app. Do some of you use the NHS app? If you do, let me know how it has been for you, and how would you feel about it all being done on your phone rather than you using it by paper or by phone and email. A much easier way to have control of things. Let me know your honest thoughts about it all down in the comment section below. Now, if you found this video interesting and informative, hit that like button, share this across social media, subscribe if you haven't already. Check out Rumble and Patreon, both of them are links in the description for exclusive content as well. And if you want to financially support me in the work that I do here on this channel, you can do so by clicking the join button down below for as little as 99p. So thank you all so much for watching, and I hope to catch you all very, very soon.